Hello, my name is Lisa Holly. Today's session will provide some insights on pharmacists supporting patients to self-manage common ailments. And specifically today, we're talking about the standards and safe handling of oral systemic anti-cancer therapies. The learning objectives of this session are to promote awareness and application of good practice standards for the safe handling and use of oral systemic anti-cancer therapies in pharmacy settings and beyond, and that includes nursing homes, care homes, in the community, and in people's homes. We also want to ensure patients have access to appropriate educational resources, including external references and monograph-based materials to support safe and informed use of oral systemic anti-cancer therapy. So what are oral systemic anti-cancer therapies? These are therapies which have become a standard part of the treatment of many types of cancers. They include oral systemic cytotoxic agents, which are sometimes referred to as chemotherapy or anti-neoplastics. These are drugs that are chemicals that can affect the cell growth and proliferation and often do not distinguish between cancer cells and healthy cells. They're considered hazardous because they possess one of the following qualities: carcinogenicity, genotoxicity, teratogenicity, reproductive toxicity, or they can cause toxicity at low doses. Now, there are some non-cytotoxic oral systemic anti-cancer therapies, and these include targeted therapies like imatinib, endocrine therapies like tamoxifen, or immunotherapy like lenalidomide. They tend not to possess the hazardous nature like cytotoxic drugs do, although sometimes they can have some teratogenicity or reproductive toxicity, depending on the agent. Now, as I mentioned, the number of oral systemic anti-cancer therapy agents is widely available now, but it's been a change over the last 50 to 100 years. So, for example, between 1953 to 2003, there were only 30 new oral systemic anti-cancer therapies approved. But fast forward to 2020, 67% of all newly approved anti-cancer therapies are oral formulations. So these are very common in the marketplace these days. Now, it's important to think about occupational exposure. Like intravenous chemotherapy, the use of oral chemotherapy presents a risk of exposure to any healthcare professional who's involved with it at any point of contact, including receiving the drug, dispensing the drug, administering the drug, and disposal of the drug, but also patients and caregivers who might be involved in those aspects as well. Now, in 2006, CareX Canada did a prevalence study looking at the exposure risk of anti-neoplastics to pharmacy healthcare professionals. What they found was that those pharmacists and pharmacy assistants in the community setting were very highly likely to have moderate or high exposure to anti-neoplastic agents because precautions were not in place. But that's in contrast to hospital workers or veterinary care settings where pharmacists had a low exposure, and that's because we already had in place good protective procedures. So how do we do this with oral systemic anti-cancer therapies? We have to think about different aspects of using the drug. So with handling, we first need to understand if it's a hazardous drug, and this can be determined from a variety of different sources. One is, does it have a pregnancy category designation, which suggests that it can alter the pregnancy or have a pregnancy risk? Secondly, the National Institute for Occupational Safety and Health, or NIOSH, gives a designation that might say that it's anti-neoplastic or pose another sort of risk. They have several designations, as you can see on this slide. And also manufacturers have recommendations about safe handling, and that could give you some information about whether the drug is hazardous. Once it's deemed hazardous, it's very important to separate these drugs and store them in a designated hazardous area. In addition, any pharmacy staff who are involved in handling the drugs from receiving to dispensing should use personal protective equipment such as gloves, gowns, masks, and eyewear. And healthcare providers who handle or administer the drugs should do the same. When it comes to prescribing and dispensing these drugs, we also should have specially trained credentialed providers who are involved in this process. And this is because these drugs have a narrow therapeutic index and have a high likelihood of potential risk to the patient if not prescribed or dispensed appropriately. So therefore, no verbal or telephone orders should be allowed, only computerized prescriber order entry to prevent medication errors. The order should include appropriate dosing information, and that often would require lab values, which are used to assess the appropriate dose, supportive care medications, which are used to prevent and mitigate toxicities, dose reductions when appropriate, and dose limit parameters. The drugs and prescriptions should always be evaluated for potential drug interactions with other home medications. And all those involved need access to the medical records to be able to accurately and appropriately dispense and prescribe and verify these orders. Speaking of verification, the pharmacist who verifies the order must do so in thinking about clinical appropriateness and against approved oral systemic anti-cancer therapy protocols that we know of. So is it the appropriate dose for the right disease, etc.? And finally, education of the patient has to occur with dispensing. Another aspect of the dispensing process is, what does the package look like? So the dispensing of the drug should be in its original package if possible, and if not, it should be in a child-proof capped container. The label itself should include a handle with care chemotherapy or cytotoxic label to designate it. There should be appropriate start and stop dates or the number of days if the drug is not taken on a daily basis, such as weekly administered drugs. And temperature requirements should also be included on the label if appropriate, such as a drug that might need refrigeration. Ensuring the appropriate temperature and storage information, thus, is very important. It should be returned to the pharmacy if there's any leftover for appropriate disposal in a hazardous drug stream, and no crushing of the tablets or capsules should be done unless it's an accepted use to try to minimize that exposure to the healthcare professional. In terms of patient education, it's very critical that we provide culturally sensitive written information that is appropriate before the patient begins their anti-cancer therapy that is systemic. It includes administration, monitoring, and how to best adhere to the regimen that is prescribed, what the effects of food may be on drug absorption, what potential drug interactions there may be, expected side effects, and management. So who is the person that they should call, have access for 24 hours a day, 7 days a week to a healthcare provider so that they can convey that information if appropriate. They should also know about safe handling, the storage, and the disposal of these drugs. If pregnancy or breastfeeding would be something that is critical to this particular patient who's receiving the drug, they should be provided that information. And finally, we should also encourage that patients avoid dose administration containers unless they separate these hazardous drugs from other medications. And then finally, a callback review should be done to check the patient's understanding, particularly if the workforce allows it. Now, if you need some resources to educate the patient, some written information, these two associations have great resources on patient education for oral systemic anti-cancer drugs, and they're widely available because you can access them freely on these two websites. So in summary, the safe handling and the use of oral systemic anti-cancer therapies should mirror those for parenteral systemic anti-cancer therapies. Pharmacists and pharmacy technicians, as medication experts, can ensure the safe, effective, and consistent prescribing, dispensing, and use of oral systemic anti-cancer therapies. Personal protective equipment is and should be used by healthcare professionals when handling any oral systemic anti-cancer therapy. And oral anti-cancer therapy should be labeled as hazardous and in a manner to promote safe and effective use. Patients and caregivers must receive structured education on the safe handling, administration, and toxicity monitoring of oral systemic anti-cancer therapies. And finally, patients must have a 24-hour telephone advice access and be issued an oral systemic anti-cancer therapy record identifying their key worker. We have provided the references that were used to create this soundbite for you, as well as further reading, which really can be helpful for you to gain a better understanding of how to safe and effectively handle oral systemic anti-cancer therapies. Thank you.